Hi guys!
My name is Evangeline.
And I'm Anna Marie.
We are massage therapy students of PRP College. Today, we will do our methods and procedure as part of our research studies. The effects of proprioceptive neuromuscular facilitation, stretching on range of motion, on internal rotation on clients with hypertonic piriformis. Let's start.
Our method will use the proprioceptive neuromuscular facilitation or PNF stretching, hold and relax on hypertonic hip internal rotation. The PNF is a stretching technique that can improve your range of motion. Many therapies uses PNF technique to help people regain their range of motion after injury or surgery, or simply they have tight or hypertonic piriformis.
The hold and relax techniques uses maximal muscle contraction to facilitate muscle relaxation before stretching. The therapist comfortably and in pain-free manner lengthens the tight muscle to the barrier. The client then isometrically without moving the joint and maximally using full strength about 80 to 100%. Contracts the muscles against the therapist's resistance for 10 seconds. When the muscle begin to fatigue, the client should fully relax the muscles about 10 seconds before starting the next set of stretch. The therapist possibly stretches the muscle by moving the limb to the range that has been gained to the new barrier. Repeat 3 times until the desired length is achieved. The effects hold and relax, lengthen soft tissue when pain and restricted range are present.
To start, we need to ask our respondent to sign the consent form. Okay, this is the consent form, Evangeline. If you can read through it and then sign, please. And let me know if you have any question about the consent form. Okay, you can.
Put it my name only?
Yes. And your last name, please. Okay, perfect. Thank you. Then we will take the measurement of the hip internal rotation, both the left and the right side. Then the respondent is already sitting on the table, making sure that her hip is at 90 degrees angle. Okay, go. And then I'll adjust the height. Okay, so making sure that the respondent is sitting on the table and her hips her thigh is at 90 degrees angle. Okay, now that the respondent have already signed the consent form, don't forget that you need also to write your name here and then sign. Okay, then we will start taking the measurement of the hip internal rotation. To do that, let us first stabilize the distal part of the femur. Then put your other hand on the ankle. Then check on the range by moving the leg laterally or on the other side. Okay? So how do you feel that? Okay?
Yes.
Okay, so that's the range. Then take your goniometer to measure the hip internal rotation. Okay. So this part is the center. This one is not moving, and this one is not moving, or the stationary part, and this angle or the pen is the one moving. Okay, so locate the patella, then the center or the fulcrum, put it in the center of the patella. This way. Just gonna adjust. Cut. Okay. Now, when you locate the center of the patella, ask the respondent to move her ankle on the lateral side or towards this side, going this way. Okay, so whenever you're ready, move your ankle towards the side. Okay, so just like that, and then check the measurement. Okay. Then after testing the right side, make sure that you also test the other side. Same procedure. We will first check the range of motion by stabilizing the distal femur and the ankle. Holding the ankle towards the side. That's your end range. How do you feel? Then take on your goniometer and take the measurement. So again, locate the center of the patella. When you're ready, Evangeline, I want you to move your ankle towards this side. Okay? Alright. When you're ready. Okay. There you go. So we just measured her internal hip rotation. Okay, so now we're done taking the measurement and checking the range of motion of the hip internal rotation. We will now ask the respondent to lie on the table, facing down, the head on the face cradle. Evangeline, if you can lie down on the table facing down, and then put your head on the face cradle, okay? Alright. Then we will start the PNF or proprioceptive neuromuscular facilitation stretching using the hold and relax technique. Alright, so now we're doing the other side of the hip. Okay, so same procedure. Lift the ankle and flex the knee up to 90 degrees. Move your arm on the medial aspect of the leg. And your elbow should be on the medial portion of the ankle or the foot. Then stabilize the hips or the posterior iliac crest. Then check on the range. Which is more flexible on this side. Let me know if you're feeling the stretch. Yeah. So making sure that you have your proper body mechanics before you're starting. Okay. Do you feel the stretch here? Okay. So since this is the end of her range, we will use this as the start range for our first set. So remember, when you're doing the set, for this research, we're doing 3 sets of 3. So in each set, there's 3 ranges that we're going to do. Okay? So, okay. You feel the stretch here? Okay. Then hold this position for 10 seconds. So this is the passive stretching for 10 seconds. 7, 8, 9, 10, and then I want you, Ange, to contract maximally. Okay, there you go. And stretch for 10 seconds. So 7, 8, 9, 10, then relax. And then move to a new range. Okay, I want you to inhale. And on the exhale, move it to a new range. There you go. And then hold this for 10 seconds. 6, 7, 8, 9, 10. And then contract. There you go. 5, 6, 7, 8, 9, 10. Relax. Are you okay, Ange? Okay. Now, inhale. Exhale. Okay. Inhale again. And then exhale. On the exhale, move it to a new range. Are you okay? Okay. Hold this for 10 seconds. 6, 7, 8, 9, 10. Relax. And then contract. Okay. 6, 7, 8, 9, 10. Relax. Okay. And then move it on another range. So this is the third of the first set. Okay, are you okay? So possibly stretch this for 10 seconds. 7, 8, 9, 10. Contract, Ange. 5, 6, 7, 8, 9, 10. Relax. Okay. And then now we're doing the second set. Are you still okay or do you need rest? Okay. Okay, inhale. And then exhale. Okay, move it to a new range. Passively stretch this for 10 seconds. 9, 10, and then contract. 4, 5, 6, 7, 8, 9, 10, and then relax. Okay, inhale, exhale, and then move it to a new range again. Okay, you okay? 7, 8, 9, 10, and then contract. 7, 8, 9, 10, relax. Okay, now we're doing the third set. Okay, so I want you to inhale, exhale, the exhale, move it to a new range. Okay. There you go. Checking the mechanics, okay? Upper body mechanics. Okay. You feel the stretch here? Okay. Is it painful or no pain? Okay. So make sure that there's no pain when you're doing the stretch. Okay, hold this for 10 seconds. 5, 6, 7, 8, 9, 10. There you go. And then contract, Ange. 2, 8, 9, 10. Relax. Do you want to rest?
Yes.
Okay, so relax. There you go. Alright. So relax for 10 seconds. Just making sure that the client, you know, and then also the muscle is not tired. Okay. 7, 8, 9, 10. You okay to proceed?
Yeah.
Okay, so remember we have a new range. We did the first set on the third, the first of the third set. Then we need to do the second one now. So inhale, and then exhale. On the exhale, move it to a new range. Are you okay? Okay. So possibly hold this for 10 seconds. 8, 9, 10, and then contract, Ange. Okay. 6, 7, 8, 9, 10, and then relax. Okay. So third now of the third set. Okay. Okay. This is a new range. Are you okay? Okay, it's already like this way now. Ange. Okay. That's it? Okay. So possibly hold this. 7, 8, 9, 10, and then contract, Ange. 7, 8, 9, 10, then relax. Okay, there you go. So with this did the 3 sets of 3 of the PNF stretch, the hold and relax technique. Okay, now we will ask Ange to sit down so that we can measure the internal rotation of her hips. Okay, Ange, I want you to sit down again facing the camera, please. Take your time. Then immediately measure the new range. We just finished doing the PNF stretching, the hold and relax technique on the hip internal rotation, and it's on the left side. Right? Okay, so left side. Now, again, the same procedure. Locate the patella and then look for the center. Center should be on the center or the anterior aspect of the patella. Then, Ange, I want you to move your ankle towards, like, away from the midline or on the lateral. There you go. So take the measurement and then write it down on the form. Alright guys, we are done with our methods and procedure for our research studies on the effect of proprioceptive neuromuscular facilitation, stretching on range of motion, on internal rotation, on clients with hypertonic piriformis. Thank you guys for watching, and we hope you learned something from this video. Again, my name is Anna Marie.
And I'm Evangeline. Remember to take it easy, smile, and take care.